Hey guys, welcome back to another session of Fun with Pharmacokinetics. What we're going to talk to you today about is when we change our dose regimen. When altering our dose regimen, we have to know what is it that we can control. What we can control is our dose rate, our dose per time. Remember, we want to keep that in the form of a rate such as milligrams per day or micrograms per hour. It doesn't really matter what you do as long as it is in a rate form. The other thing that we have control over in our patients is how often a patient is getting a medication or the tau. We can give things every 6 hours, we can give things every 12 hours, we could even give things every 72 hours. The things that we cannot control is clearance, volume, and bioavailability. As awesome as we pharmacists are, we can't really control what's going on in the body. So when one of these things gets altered and changed is our dose rate and our tau. So let's look at the next slide to see how we can utilize this. To begin, when do we alter our dose rate? The first question we have to ask ourselves is our CSS average in an acceptable range? If the answer is yes, well, we don't have to worry about anything. But if our CSS average is not in an acceptable range, we can increase or decrease our dose rate to get to the CSS average that we are desiring. Now, there are a couple reasons why our CSS average could change. There could possibly be a change in bioavailability. If our bioavailability increases, it causes our CSS average to increase. Maybe we are already at the perfect concentration at steady state, and this change in bioavailability changed that. So we can decrease our dose rate to lower our CSS average back to where we want. Now, just the opposite is true. We could have a lowering of our bioavailability, and that will cause a lowering of the CSS average. We also have things that affect clearance. If there is a change in our clearance, say our clearance increases, that'll cause a decrease in our CSS average. And if we have a decrease in our clearance, that'll cause an increase in our CSS average. But we can't fix our bioavailability and we can't fix our clearance to make our CSS average do what we want. So what we affect is our dose rate. And we'll look at the next slide to show us how to do that. Now, our CSS average is going to tell us the area under the curve at CSS average given over a period of time. And our area under the curve is basically just our exposure time. There are going to be times with certain drugs that need a higher exposure time than others. So to get a higher exposure time, we need a higher CSS average. And the only thing that we can affect that can increase that CSS average is our dose rate. So let's look at this example. Say originally the patient was getting 250 milligrams every 6 hours, which gave us a CSS average of 2.1. Although that's nice, we needed to double our CSS average and target something closer to 4.2 and increase the exposure. All we would have to do is double our dose rate, which is just increasing it from 250 milligrams every 6 hours to 500 milligrams every 6 hours, and our CSS average doubled. As you can see between these two lines, K hasn't changed, it's still the same. Bioavailability has not changed, and neither has clearance. All we had to do to raise this CSS average up was increase our dose rate. So, just to sum it up in one quick slide, when do we change our dose rate? The first thing we do is ask ourselves, is the CSS average at the target range we want? If the answer is yes, woohoo, no changes for us, our job is done. However, if the answer is no, we have a second two-part question to ask. We have to ask ourselves, is the CSS average too high or is it too low? If our CSS average is too high, we lower our dose rate, and that will cause a decrease in our CSS average. Now, if our CSS average is too low, we just increase our dose rate, and that'll increase our CSS average. So to sum it all up, if you don't have the desired CSS average you want, adjust your dose rate, and that will make the difference. Thanks for listening, guys. Have a great night.